Hello everyone, I'm Susan Birch and welcome back to another Healthy New Zealand podcast. Today I'm talking about the headlines we saw last week showing research demonstrating an increased risk of COVID-19 complications if you have type 2 diabetes. More and more studies are showing this association. This doesn't mean that if you've got high blood pressure, obesity, or type 2 diabetes, that you've got a greater risk of catching COVID-19, but you do have an increased risk of complications if you get it. 80% of Kiwis are metabolically unhealthy, with 250,000 diabetics. If we want to protect ourselves from the consequences of COVID, reversing this trend would seem like the obvious and most cost-effective solution that we could put in place. I'm surprised we don't hear anything from our government or media about this. There isn't a single political party that focuses on solutions to improving the underlying health of New Zealanders. They all prefer to queue up the ambulances at the bottom of the cliff. They focus their attention on drug availability rather than remission from disease. Providing drugs will treat the symptoms, but it doesn't deal with the underlying root cause. If we could deal with the root cause, that would offer us a cost-effective and long-term solution. But then many of our politicians and medical professionals are as metabolically unhealthy as the rest of the population. We're constantly told that type 2 diabetes is a chronic and progressive disease that is irreversible. And this is another example where science got it wrong. And it's taking far too long for changes to be implemented. They are happening slowly, but governments, medical boards, doctors, and health foundations really need to catch up with the science. The evidence is very clear. Prediabetes happens as you exceed your ability to control glucose, and then you need to produce more and more insulin to keep your blood sugars normal. Insulin normalizes blood sugar by storing more energy in your body fat. And as you store more energy in your fat cells reach maximum capacity. And this is called your personal fat threshold. And it's at this point that your cells become insulin resistant. This means that despite all the insulin you're producing, you can't get your glucose out of your bloodstream, and so then type 2 diabetes is diagnosed. You don't have to be overweight or eat junk food all day for this to happen. We all have our own genetic tolerance to the sequence of events. Just think about the Southeast Asian population who get diagnosed with type 2 diabetes at a much lower body weight than other ethnic groups. So we need to work out our own individual tolerance to carbohydrate foods to keep this under control. I know I've got quite a low tolerance myself. And it's important that your GP check your fasting insulin when running blood tests. Elevated insulin can show up for 15 to 20 years before you see changes in your weight or your blood sugar levels, or before your HbA1c starts to go up. The complications of uncontrolled diabetes are enormous, and we're all too familiar with these: cardiovascular disease, nerve, kidney, eye damage, poor circulation, resulting in foot problems and amputations. And now we have added to that list an increased risk of complications should you get COVID-19. A Healthy New Zealand is a place you can go to seek more information and up-to-date science. You can subscribe to the podcast and be notified when new interviews and reviews of the science are done. And you can find a ton of free resources, recommended books, and other podcasts from around the world on weight loss and type 2 diabetes and other health topics at the website, which will be posted in the show notes. If you would like to try Professor Ben Bickman's meal replacement designed for weight loss, type 2 and type 2 diabetes, you can get a 10% discount by using the coupon code The Health Detective. Professor Bickman is an expert in metabolic issues, obesity, and type 2 diabetes, and you'll find a couple of podcasts with him talking about this on the website. The link to the Australian website that ships the health code to New Zealand is in the show notes if you'd like to have a look at that. I've been enjoying this as a post-recovery drink, and it's also really handy to have on hand when you need something quick and easy, when you don't sort of have the right food immediately available. Thanks for listening, and I'll talk to you again next week. I hope you can all stay warm out there and enjoy the rest of your day.